Hi, my name is Anthony Marin. I'm a certified specialist in reproductive endocrinology and infertility in private practice with Janaea. Today's video is going to go through the IVF process for those couples that are about to embark on it. Step one of any IVF process is the stimulation of the ovaries. Now, in terms of a normal ovarian reserve, a female will have somewhere between 5 and 12 follicles per ovary. And in a normal month, one of those follicles will grow, develop and ovulate, and the others merely just die off. The IVF process just exploits the fact that there's multiple follicles there, and we use daily injections of a hormone called follicle stimulating hormone, or FSH for short, in order to try and recruit as many follicles as we can. In practice, we can't recruit all of those follicles. We can normally recruit about half to 2/3 of those follicles, as some of those follicles are in the process of actually dying off. Now, on the slide that you can see now, the upper image basically shows that there's an ovary with a dominant follicle, and then there's a whole bunch of follicles around the ovary that are yet to be recruited. And this is what happens in a natural cycle. Whereas on the image below, there are multiple follicles that are all quite large, and that's because the IVF medications have recruited them and have caused them all to grow. There are two main types of IVF cycles that are done these days. The most common cycle is what's known as the antagonist cycle, or the short cycle. In this cycle here, most women will come in day one for a blood test to make sure their hormone levels are flat. The injections normally get started on day 2, and the female will usually take these injections for about 8 to 12 days. In order to stop a woman from ovulating prematurely, we normally add in a second medication, usually from about day 5, and that continues until the last day of stimulation. The second cycle is what's known as the agonist cycle, or the long down regulation cycle, and it's actually the older cycle that's used in IVF. What we do is we actually start with a medication. It's either a nasal spray or an injection, and we actually start a week or 2 weeks prior to the FSH injections. And the job of that initial medication is actually to get control of the cycle and to stop the woman from ovulating early. Once that medication has worked and the woman's hormones are completely flat, that's when we get started with the FSH injections. In practice, there's not a great deal of difference between the two in terms of outcomes. The evidence would suggest that we get slightly more eggs in a long as opposed to a short cycle, but the actual pregnancy rates are similar. There are some reasons why we would use one cycle over another, and certainly you do see that some people do better on one cycle as opposed to the other. The second step of the IVF cycle is the egg and sperm collection. In regards to the egg collection, once the follicles are large enough that they're likely to contain a mature egg, the female takes what's known as a trigger injection to start the ovulation process. The egg collection has to occur 36 hours after that trigger injection actually occurs. The egg collection is done in a day surgery, and the female has the option to either have a general anaesthetic, so going to sleep, or she can have some sedation with some local anaesthetic and she can be awake for the process. At Janaea, we're happy for the partners to be present or a support person to be present. Essentially, we start by passing a speculum, so like a pap smear, and we clean the opening to the womb. We then insert the ultrasound probe, just as has been done with the follicle tracking scans throughout the stimulated cycle. And if the female is awake, then we normally inject some local anaesthetic into the sidewalls of the vagina. Gently, we then pass our needle into the follicles within the ovary, and we drain the fluid in those follicles, and the fluid goes across to the scientists and they retrieve the eggs. And we go from one follicle to another, and we obviously do both sides. The egg collection process takes in total about 30 minutes. It obviously depends on how many follicles are present. So if someone has only got a few follicles, then the procedure is done quickly, whereas someone has a lot, then it can take a long time. The procedure is usually quite well tolerated, and we just provide some simple pain relief afterwards. However, it is important that you take at least that day, and some people need the following day off work in order to recover. From a sperm collection perspective, the majority of the cases the male provides a sample of sperm in one of our collection rooms. Occasionally, if ejaculated sperm cannot be provided, usually for medical reasons, then sometimes we need to either do a testicular aspirate or biopsy in order to retrieve the sperm. The third step of the IVF process is bringing the egg and sperm together, what's known as fertilisation, and then embryo development. And this process occurs within the lab. Egg and sperm can come together one of two ways, either the standard IVF or a process what's known as ICSI. If the sperm quality is good, so there's good numbers, they're moving, they look normal under the microscope, then usually we just place several 100,000 sperm on top of the eggs, and we allow the sperm to fertilise the eggs naturally in the dish, just as they would as if they were in the fallopian tube. If there's a problem with the sperm, so a reduction in numbers or poor motility, then sometimes we need to do what's known as ICSI, what's known as intracytoplasmic sperm injection, and that's where the scientists inject a single sperm into the egg in order to overcome any fertilisation difficulties. We prefer to do IVF if we can, and that's largely because we find that our embryo development and ongoing pregnancy rates are better from our IVF embryos as opposed to ICSI. The scientists check to see how many eggs have been successfully fertilised the morning after the egg collection, and ordinarily you'll get a phone call to say how many eggs have fertilised. That single fertilised egg then basically undergoes division, and so by day 2 the embryo then consists of about 4 to 6 cells, by day 3 about 6 to 8. There's a massive change from day 3 to day 5. The day 5 embryo is known as a blastocyst. It consists of over 100 cells, and it's divided itself into two structures. There's an inner group of cells, what we call the inner cell mass, that forms the future baby, and then an outer layer of cells, what we call the trophectoderm, that forms the future placenta. It's those embryos, the blastocysts, that are suitable for either transferring or freezing. Now, unfortunately, you get a significant drop-off throughout the process. So, for instance, if we retrieve 10 eggs, we might find that only 8 fertilise. If 8 fertilise, we might find that 6 make it to day 3. And if 6 make it to day 3, we might find that there's only 2 to 3 usable embryos on day 5. And that's fairly typical or average. Some people do better than that, so if they get 10 eggs, they might find that they end up with a larger number of embryos on day 5 suitable for either transfer or freezing, but some people do worse. And so some people might get good numbers of eggs, but they may have nothing suitable for transferring or freezing on day 5. And we won't know that until you go through the IVF process. Step 4 of the IVF process is the embryo transfer. And this occurs on day 5, and that's because that's when the lining of the womb is most receptive to the embryo. In this situation here, you come into day surgery, the scientists and I sit down and have a discussion with you in regards to embryo development. We take you through to the procedure room, and you can bring a partner or a support person along if you wish. We can show you the embryo on the screen if you want to see that. And essentially we pass the speculum just like a pap smear. We clean the opening to the womb, and then we pass a fine plastic straw through the cervix into the uterus, and we inject the embryo. The process is done relatively quickly, and we can take you back to recovery where you can sit down, relax, and then basically go back to work. For this procedure, you do not need any pain relief, and you normally don't need to take any sort of time off work. The fifth and final step of the IVF process is waiting for the pregnancy test. If you have a day 5 embryo transfer, the pregnancy test is usually performed 11 days later. We normally will provide you with some medication, and it's either an injection where there's 2 that are taken, or it's a cream that's vaginal that's taken throughout the 11-day process. And essentially, there's not much that you can do during this time in order to improve your chances. A lot of people find this the most difficult part of the cycle, because at least with the first half of the cycle, you're busy coming in for blood tests, ultrasounds, and having procedures, whereas in the second half of the cycle, it's just a bit of a waiting game. If you do find that this part of the cycle particularly stressful, Genea does offer support via its counsellors, and I'd strongly recommend that you give them a call and seek assistance. Thank you for listening to today's video on the IVF process. I hope you found it informative. For more information, visit my website, marincampbellmackie.com.au, or you can call the number that's displayed on the screen for a consultation. Thank you.